Welcome to the SVG-TV news. It's for Monday, November 29th. I'm Khalil Kato with the details. A new COVID-19 variant is reportedly spreading rapidly in parts of South Africa, and scientists are concerned that its unusually high number of mutations could make it more transmissible and result in immune evasion. The new COVID-19 variant is called the Omicron variant. Speaking on the new variant on WeFM's Issues at Hand program on Sunday, infectious disease specialist Dr. Gerald Thompson said this is a very serious matter where countries across the globe are now reacting to the new variant, with 6 countries already affected thus far. Dr. Thompson said that what is worrying about the Omicron variant is the extremely high number of mutations.
The mechanisms inside human cells to replicate and multiply. And when they multiply, they have to multiply fast. Billions of virus particles have to be produced very quickly. Now, there are viruses like the DNA viruses, herpes, that have not changed for thousands of years. They're the same virus as they were 100 years ago, 1,000 years ago. Whereas the coronaviruses belong to a group of what we call RNA viruses that just mutate. If you hear that scorpions sting, coronaviruses love to mutate. And that's essentially what they do. Now, most of these mutations that occur make the virus weaker. Believe it or not, it makes it weaker and less able to survive. But every now and again, some variants that are produced through mutations are stronger. And they can, if they infect other people, they're more transmissible, they're more infectious as they're stronger.
Dr. Thompson said the new Omicron variant might be up to 500 times more transmissible than the Delta variant.
That those early figures turn out to be less. The great concern is if it has reached that ultimate next stage where it can escape our immune response altogether, leaving us at greater risk. Now, mutations don't ever usually affect the testing ability of PCR or rapid tests. We usually pick those things up by different means, and so the mutations don't affect the PCR test and so on. But the spike protein is critical in 2 major ways. One, it has what's called a receptor binding area that when the mutation that takes place there that makes it stronger can make it more sticky. So it's able to stick on to cells in the back of your nose and your lungs quicker and easier. And therefore, that causes it to be more transmissible.
80 new positive COVID-19 cases were reported from 163 samples collected on Friday, resulting in a positivity rate of 11%. 7 positive and rapid antigen results were also reported on Friday from flu clinics. On Saturday, 4 positive cases were reported from 68 samples, resulting in a positivity rate of 5.9%. And on Sunday, 3 positive cases were reported from 10 samples, resulting in a 30% positivity rate. There are currently 4 patients admitted for COVID-19 at the Argyle Isolation Facility, all of whom are unvaccinated. 6 patients have also been admitted to the COVID-19 ward at the Milton Cato Memorial Hospital. 5 of these patients are unvaccinated and 1 fully vaccinated. There were no deaths or new recoveries over the reporting period. 460 cases are currently active and 74 persons with COVID-19 have died. To date, 5,525 cases of COVID-19 and 4,991 recoveries have been recorded in St. Vincent and the Grenadines since March 2020. The SVG Teachers Union is continuing a series of protest actions in support of their unvaccinated and vaccinated members. Over the weekend, the union said they met with some members, advising them to continue to go to physical and online classes today and tomorrow. The union further encourages members not to attend face-to-face and online classes on Wednesday and Thursday, but to continue with all normal work on Friday. The SVGTU says it continues to endorse the united efforts of the teachers at the West St. George Secondary School to demonstrate solidarity with their colleagues and strongly encourages other staff to do likewise. The SVGTU says it will further advise its members as to the plan of action by December 5th. An updated national food-based dietary guidelines was launched on Friday under the theme, Choose Well, Live Well. The first ever national food-based dietary guidelines were launched 15 years ago on October 16, 2006. However, as with the shift and transition of dietary and lifestyle habits, the Ministry of Health and the Ministry of Agriculture saw the need to review, update, and retrofit the guidelines with the trend of time. Giving an overview of the updated guidelines, senior nutritionist in the Ministry of Health, Nicole France, outlined the 9 new guidelines, which she said aim at getting Vincentians to say no to trans fat and reduce salt and sugar intake by avoiding highly processed foods.
One, a 3D graphic, is geared for adults, and the second, which is a 2D graphic, designed for children with a picture of Mr. Breadfruit in the center as a mascot, encouraging our children to drink water and follow the guidelines. The breadfruit is divided into the proportions of the 6 food groups. These are staples, vegetables, fruits, food from animals, legumes, and fats and oils. You will not find sugars and sweeteners as depicted on the old graphic, which many persons mistakenly took as a 7th food group. What you will find are images that highlight and promote healthy lifestyles and positive behaviors such as shopping, eating, and exercising together as a family. The graphic also depicts at the base foods which we are to avoid.
2 new updated graphics, skillfully crafted by local designer Ken Dyer, were also launched on Friday.
The 9 messages are as follows. 1. Enjoy a variety of natural foods from each food group daily. 2. Include local fruits and vegetables in every meal. 3. Choose steaming, boiling, and baking as healthier methods of cooking. 4. Be safe. Prepare, cook, and store foods safely. 5. Avoid highly processed foods and snacks. They are high in fats, sugars, and salt. 6. Water is essential. Drink at least 8 glasses daily instead of sugary drinks. 7. Get moving. Enjoy 30 minutes or more of physical activities daily. 8. Grow your own and choose local foods. And 9. If you use alcohol, do so sparingly.
The senior nutritionist used the opportunity to further encourage Vincentians to go back to traditional and indigenous foods.
And in so doing, support our local farmers or even starting our own backyard gardens. Backyard gardens are also a means of ensuring food security and sustainability in the homes, as we will have access to vegetables and fruits for regular use in the diets. This practice will also afford us the opportunity to introduce natural foods into our children's diet on a regular basis. Good nutrition is utmost important from an early start. It is also important that we as adults set good examples and be role models for the future generation. Enjoy the numerous health benefits that these foods have to offer. Vegetables are not to be served only on a Sunday, but every day. If we grow our own, it becomes available, accessible, and affordable. However, these foods need to be prepared using healthier cooking methods.
Meanwhile, Permanent Secretary in the Ministry of Agriculture, Narissa Gittins-McMillan, said an update of the 26th version of the food-based dietary guidelines is a significant step in responding to the emerging realities of St. Vincent and the Grenadines, including the sedentary lifestyle adopted and the increased consumption of unhealthy food. Gittins-McMillan said the guidelines are also a tool that will be used to support the adoption of better food choices and as a driver of more healthy food produced locally. She said it is also a component of the Zero Hunger Challenge initiative of SVG to eradicate hunger and malnutrition.
St. Vincent and the Grenadines is experiencing increased cases of non-communicable diseases that are also affecting our children, such as obesity, cardiovascular diseases, and diabetes. As a nation, we strive to ensure food is available and accessible to our school feeding program that provides children nutritious foods in primary schools, the Zero Hunger Thrust assistance to the vulnerable, especially the elderly, the care packages distributed to the food insecure in 2020 and 2021 are just a few initiatives that contribute to the well-being of our citizens. We must applaud our food producers who work tirelessly to ensure food is available, the production of food.
And Agriculture Minister Soboto Caesar, in his remarks, encouraged nationals to ensure that the foods they eat are safe.
To speak to food safety, since it is linked to nutrition and food security. Our youth, I encourage you to engage in food production and engage in innovative techniques and technologies as the next generation of food producers. Let the food we grow not just feed us, but nourish our bodies. Our wealth as a nation is the health of our people. Choose wisely. Let us buy local.
Also speaking at the ceremony was Permanent Secretary in the Ministry of Health and Wellness, Cuthbert Knights, who said that the updated guidelines represent an important part of the National Food and Kitchen Policy. He further noted that the updates are also in line with the sustainable goals for 2030.
Updating the food-based dietary guidelines addresses two fundamental challenges or gaps. One is the need to address an ever-increasing trend of overweight and obesity. Two, the need to address the high dependency on food importation and poor food choice. Addresses two, in spite of our capacity to produce food domestically, St. Vincent and the Grenadines have significantly increased its food import. Such imported food tend to be low in nutrients, very energy dense, and high in fats, oil, and sweeteners, salt, and sodium. Against this backdrop, there is definitely a need for an intake of fruits and vegetables amongst the population.
Speaking on the increase of non-communicable diseases in St. Vincent and the Grenadines, the Minister of Health and Wellness and the Environment, Sinclair Prince, noted that this is because of unhealthy diet, physical inactivity, and excessive alcohol use. Minister Prince said he's hoping that the messages in the guidelines will be used as a stepping stone to produce a healthier SVG.
In 2014, a National Health and Nutrition Survey was conducted to ascertain the health and nutrition status of the population. The results were staggering. It was revealed that obesity and overweight were prevalent among the 18 to 69 age groups, with a total of 67.2% females and 41.3% males being overweight. 95% of the surveyed population ate less than the recommended 5 servings of fruits and vegetables per day. 60% of the population was not engaging in vigorous physical activity, and 54% of the women were found to have 3 or more of the risk factors contributing to NCDs. These situations could only worsen during the current COVID-19 pandemic, as the schools are forced to remain shut, and the disruptions in essential healthcare services will only limit access and hamper the monitoring and care of people living with NCDs. I implore you, my fellow Vincentians, to choose well and live well. Follow these 9 guideline messages as we try to build a healthier nation.
The 2021 Atlantic hurricane season will officially come to an end tomorrow, and manager of the SVG Meteorological Services, Billy Jeffers, is again encouraging persons not to let their guards down, as weather activities can continue after the season has ended. Speaking on NBC Radio's face-to-face program this morning, Jeffers gave an overview of this year's season, noting that there were 20 major storms, 7 hurricanes, and 4 major hurricanes across the Atlantic basin.
Based on the numbers, it was an active season. So in relation to St. Vincent and the Grenadines, and I mentioned this on the last program I was on, I think it was the 18th of October, we were impacted by Hurricane Elsa on the 2nd of July. And I think we, Vincentian, should count our blessing with the track of this hurricane. The center moved over the volcanic restricted zone, the red zone, well, exactly over North Winterford. And at the time, the all clear was given for residents to move back. So it was somewhat deserted. There were just a few persons who remained, and they would have experienced the brunt of the hurricane force winds.
Jeffers further spoke on the impact of the Atlantic hurricane season locally.
So in terms of impact, and Miss Forbes was on last week or the week before, yes. So she mentioned some of the impacts from Elsa. So they had damage to homes and other infrastructure, down utility poles, loss to crop and livestock. And based on a preliminary damage report received from NEMO, there were over 250 homes with sustained damages, and they were mainly to the roofs.
He's also reminding persons living close to river valleys of La Soufrière to be extremely cautious, as there are likely to be lahars even in the dry season.
Had a significant rainfall event, as you may recall, on the 29th of April, and this was just after the explosive eruptions of the La Soufrière.
Yes.
So what happened? They had a lower moist atmosphere, and they were supported by a very favorable upper atmosphere. So the rainfall from this event, we had 6 inches of rainfall in about 12 hours recorded in some parts across mainland St. Vincent. And flooding and landslide were reported mainly around capital Kingstown. I think there were some landslides reported around Villa and so forth. But what happened with this event was that, you had a lot of ash still in the drainage system, so this didn't help at all. Okay?
Right.
So in addition to this, right, the Met Services, we had to issue several advisories, watches, and warnings before rainfall events. And during these events, flooding mainly occurred in the valleys of the volcano and lahars, and which we know lahars are settled ash and volcanic debris.
One of the Ministry of Agriculture's main objectives for the upcoming year is to reduce the country's $200 million food import bill. So said Minister of Agriculture Soboto Caesar while addressing the handing over ceremony of 2 greenhouse structures last Wednesday. Minister Caesar said that in 2022, the Ministry of Agriculture will see the unfolding of a unique program in the sector through a well-planned community initiative.
This is a people-centered government, and we are going to continue to deliver to the farmers of St. Vincent and the Grenadines. And we cannot sit idly by and see a food import bill spiraling out of control in the region and think that we are not to participate in its reduction. So not only are we going to reduce the food import bill as an important quest in our journey ahead and invest in livestock, but we also have to look for niche markets where we are going to carve out certain spaces to increase exports.
Minister Caesar said that there will also be a plan for the establishment of a public-private partnership to ensure that there is a consolidation framework between SVG and several Caribbean countries for commodities.
Grenada, St. Vincent and the Grenadines, St. Lucia and Dominica for commodities. And I say this again, this will not be an initiative done purely by the state. There are private sector entities that will play a very important role in ensuring that this is a success. And not only the standpoint of consolidation in marketing, but we have to address the issue of crop insurance. We no longer have wind crop, and there are private insurance companies expressing an interest within the Windward Islands to ensure that we rebuild that important arm of the development of the food sector.
The Agriculture Minister further spoke about plans to address the issue of fisheries expansion. He said that very soon the doors of Rainforest Seafoods in Kalyaquar will be opened, and the intention is to purchase $20 million worth of fish from local fisherfolk annually.
And in the aggregate, for the other exporters and the other centers, they probably in the aggregate will do a similar number. So we are talking about going into 2022, focusing on a $40 million industry. It means that our young people would have to be retooled. Already, there are children of farmers who are being called to work in these processing centers for fish. And that is all part and parcel of the evolution. And I want to speak to the young people in the different communities as the Minister of Rural Transformation and Industry. I don't want you to say things like, well, I am from Diamonds and see don't have no back door, and I don't want to become a boat captain. I don't want to work on a boat because I can't swim. Well, if you can't swim, you have to learn to swim.
A 27-year-old laborer of Sandy Bay is currently warded at the Milton Cato Memorial Hospital with an injury to his neck. According to reports, on Friday on the island of Bequia, the patient got into an altercation with an assailant who chopped him with a cutlass. The assailant is in police custody, assisting with investigations. Persons with information that can assist with this investigation are encouraged to contact the Deputy Commissioner of Police at telephone number 451-2467, the officer in charge of the Grenadines, or any police station or police officer you're comfortable with. All information received will be treated confidentially.